morning from Monday Mantra. Taking off from where we left off last week, I addressed an issue about young dentists, interns, or just a fresh graduate as to how they should be looking around to observe or work in a clinic. Let me take the other part. That is, we as clinicians, what should we be looking for when you want a young dentist to join your practice? Or can I take two steps back and say, when is it that you should add an associate to your practice? I feel that in about 3, 4 or 5 years' time, when you have a steady flow of patients, when you're into scheduling, you probably will need a young associate, not an assistant, because when you address or introduce them to your patients, you should be using the word associate. I learned this very early in my practice, that it adds value and a team is projected to your patients. So when you are looking for a young associate into your practice, what are the qualities that you will look for? A, I would ask the young dentist to start coming to my clinic for about a week with flexi hours, where he just comes in and observes the working of our clinic, and we observe the passion that is there in his belly to make it as a clinician, the interest that he shows or displays, the knowledge that he possesses, knowing very well that the skills will hone over time. It is when you are convinced that yes, here is a person who can actually be part of my team, embrace that person into your practice, explain to them the philosophies of your clinic. You may have your own definitions of patient first that should be conveyed to that associate. He also should be made to feel that he belongs to the clinic team. The front office person, your auxiliaries, your patients, all of them need to accept and respect this individual who he is now going to be entrusted with the patient work independently. When a patient walks in, and I've done this in my practice, I want to share this with you. Every new patient is first seen by the new associate. There are patients who would sort of say, no, we want to be seen by the senior dentist. But that's okay. You can tell them that initial examination will be done by this young dentist, and I will step in later. Once you also make sure that this new dentist, young dentist, new member of your team is projected as an independent, capable dentist, the patients will accept. So what do I suggest? Look for a youngster who actually has a lot of interest to work long-term, reasonable long-term. I know that nobody is here eternally to be with your team, but reasonably the youngster should be able to give you a couple of years of commitment. That's when you are confident to introduce him to your team. Nothing stops you from displaying his name on the signage outside, with mutual consent, of course. So with this, what happens is the youngster feels very confident and he gives you all that he possesses. When I say he, it could be a she as well. And your practice will go to the next level. This is how I have gone about adding associates over the years. And let me tell you one more thing. When they do decide to leave with adequate notice, don't grudge them their exit. Help them to promote their own interests wherever their life takes them. I have enjoyed my associates. I'm very fortunate to be at the head of a clinic where associates have actually helped me where I have reached. A big thank you to all the associates who have worked with me. Thank you.